Magnesium is crucial for over 300 processes in your body, from energy production and muscle recovery to sleep quality and stress response. Yet most Americans don't get enough. In fact, in a peer-reviewed clinical trial published in the Journal of the American College of Nutrition, more than 75% of participants showed suboptimal magnesium levels before the study even began. Those who took Jigsaw Mag SRT, a time-release magnesium malate tablet, saw magnesium rise 30% over 90 days, and deficiency symptoms dropped by 63%. Remarkable results backed by real science. And for sleep and recovery, Jigsaw Mag Soothes delivers. In a 4-week clinical trial tracked with Oura Ring data, participants saw a 17% improvement in sleep quality, felt 34% less stressed, and rated their satisfaction 85 out of 100. 82% said they'd buy it again. 2 supplements, 2 clinical trials, 1 company that does the research. Jigsaw Health. Mag SRT for daily magnesium replenishment. Mag Soothe for calm, restorative sleep. To order, go to jigsawhealth.com. That's jigsawhealth.com. Use coupon code Hoffman15 for 15% off your order. That's jigsawhealth.com, code Hoffman15. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're taking a look at the linkage between the brain and the body. It's a two-way street. The body influences the brain influences the body. So people who have apparently what seem like medical symptoms may be influenced by their brain. But conversely, people who seem to have psychiatric disorders, it may reside in their body. And kind of have a medical detective at our disposal today, Dr. Susan Trackman, who is a board-certified psychiatrist and author of It's Not Just in Your Head. And, you know, that title kind of conjures up the notion of something that now has earned the sobriquet of medical gaslighting. We see a lot of medical what is medical gaslighting when it comes to patients with complex disorders that come to see you?
Okay. So, the term gaslighting originally came from, I think, a 1940s movie.
It's a great movie. Got to see it. Oh, my goodness.
Yeah,
Charles
it was Hitchcock,
Boyer
right?
and
Was it in 1940s?
It was not Hitchcock. It was Charles Boyer and Ingrid Bergman.
Okay.
And just a fabulous movie. People should see it to understand the basis for that term. Because we now use the term. Most people haven't seen the movie. 1944
I think a lot of people
movie,
don't even know really what the gaslighting means. But essentially, in this movie, just to summarize it, you correct me if I'm wrong, because it sounds like you might be more familiar with it than I am. This man tried to convince his wife that what she thought was true was not true, even though it really was.
Yeah.
And, you hear about this in relationships where someone comes in and says, oh, my husband is gaslighting me. My boyfriend, my girlfriend is gaslighting me. It's the attempt to make another person believe that what they believe is true is not really true.
It's delegitimizing them.
Right. Exactly. So in the medical system, medical gaslighting is exactly that, where a practitioner, I think mostly unintentionally.
Yeah.
I think most of us who go to medical school do it for good reasons, but I think it's when a provider unintentionally dismisses or minimizes a patient's concern about what is going on with them, or the way they report what is going on with them.
Perhaps in an attempt to reassure them, or a well-meaning attempt to say, well, I can't find anything, maybe you should get an antidepressant, to relieve your symptoms.
Right. And sadly, it's more common. The folks who are more likely to hear this are females and people of color.
Exactly.
And I mean, there are case reports after case reports, even recently, about people who've gone to the emergency room and to report symptoms, and the emergency room provider will be somewhat dismissive. I don't remember this case, but it wasn't too long ago, and I can't remember exactly where it took place, but a young woman went to the emergency room with complaints of abdominal pain. They looked at her, they listened to her, they didn't do any kind of scans. They just said, oh, you're probably constipated, go home and take some Maalox. P.S. 4 months later, she reports back to the ER with the same kind of complaint. She has metastatic colon cancer.
Yeah.
So that's an example.
And that's not just a one-off,
No, not at all. And the fact that also women present very differently than men with certain symptoms, including very common ones like cardiac symptoms. Women who are having heart attacks often present very differently than men.
Hmm.
So they may be more likely to be missed if they're not presenting with classic symptoms like chest pain, an
Yeah.
elephant sitting on my chest. They're coming into the emergency room saying, I have heartburn.
Yeah.
Okay, go
Or
home, take
or I
some,
have an
Pepsid.
uncomfortable feeling in my jaw, that kind of thing.
Right,
Yeah. I
right.
actually attended this is on a Viking cruise. The cruise director, of all people, passed out. And,
Oh,
we just thought she had, vasovagal syncope. She had too
hmm,
many cups of coffee. She was a little hypoglycemic. But she
right.
was laying there. She said, I have a very uncomfortable sensation in my jaw. She was a young woman in her
Yeah,
40s.
yeah.
And we said, we're on a boat, but this is a 911 situation. We docked. Ambulance came, took her off, tested positive for cardiac enzymes. She
Yeah,
was having a cardiac
yeah.
episode. So,
Good thing you were on the boat.
yeah, yeah. I, I don't know. It's maybe you shouldn't travel with me because bad things befall people who travel with me on planes and
I can't
boats.
tell you how many times I've been on trips when they've asked, is there a doctor?
Yeah,
Yeah,
yeah.
yeah.
So, so actually, in your book, you illustrate that there really is such a thing as heartbreak. Literally,
Hmm.
you can be
Yeah,
heartbroken, and
yeah.
that's not a figure of speech.
No. Well, I think people think about it as like, a heartbreak, you break up with someone and you're
Yeah.
so sad. But there actually is a condition, it's a Japanese term. It's called Takotsubo's cardiomyopathy. And that's a mouthful of words. But essentially, from the Japanese, in Japanese, Takotsubo is the word for an octopus trap. And if you look at the scan of someone who has experienced Takotsubo's cardiomyopathy, it looks like the distortion in the heart looks like an octopus trap, so which is why it's called that.
Hmm.
But what really happens is the stress of losing someone significantly or having a tremendous loss in your life, and I can give some examples, causes changes in the pumping chamber of the heart, the left ventricle, which can make it function inappropriately. And the good news about it is it's reversible. Um, there's several examples. I think the one that I lead off, there's a chapter in my book where I lead off about, Carrie Fisher of Star Wars fame,
Yes.
who unfortunately, died early, young in her 60s. And her mom, Debbie Reynolds, also very famous, was at home waiting for her for Christmas dinner. And when she learned that her daughter had passed, she died 3 days later.
Yeah.
She didn't have any underlying condition that would have explained that. And there are a number of, famous cases like that, Johnny and June Cash. And, but that is a real condition. And we call it broken heart syndrome because it often occurs in the aftermath of the loss of some sort, the death of someone, a separation. But there actually have been cases of this even reported after a very energetic Zumba class.
Oh, wow.
So
Yeah.
there's something about what happens in terms of our adrenaline,
Yeah.
noradrenaline,
It's like
the face
it's
of
a
that.
fight or flight kind of reaction. And
Exactly.
sometimes the body interprets exercise as fight or flight. It's like you're running.
True.
The body doesn't know whether you're in a Zumba class or running away from a saber-toothed tiger.
Exactly. And I like the fact that you use that example because I think I do too.
Oh,
So,
you
right,
did.
because
Okay.
like a panic, when I explain a panic attack to
Yeah.
someone in my office,
Yeah.
and like, your body is misinterpreting what's going on. If you were being chased by a man-eating tiger, these symptoms would be perfectly normal and in fact would help save you.
Hmm.
But in the context of, sitting in a concert, they
Hmm.
make no sense.
Right. Oh, and let me throw this in because the myth of Pan. Pan was a mischievous forest spirit, and one of his
Yeah.
favorite tricks is, and you probably know this story, but I'll recite it anyway. One of his favorite tricks is travelers who were traveling from city to city would sometimes traverse the wilderness, and Pan would hide
Mm.
behind some trees and rustle the branches a little bit, and then the traveler would hasten their steps, and Pan would run ahead and then rustle some branches some more. And he kept doing it until the traveler was in full blown panic.
Uh-huh.
Okay.
Yeah.
So panic is associated with
It-
physical exertion too. I mean,
Doesn't it also come from the name Pan?
yeah, of course. Yeah.
Yeah.
From pan.
Yeah.
Yeah. the mischievous spirit, forest spirit. Yeah.
Right, right. Yeah, I love the Greek myths. I mean, a lot of the terms we use nowadays, they do come from Greek and different kind of Greek or other foreign languages. But no, I love that. I hadn't remembered the exact story of Pan, but yes, it makes perfect sense.
So yeah, so I guess what that suggests is that for some of your patients who are suffering from anxiety, they may be high-end athletes. They may be,
Yeah,
marathoners, and
yeah.
perhaps they're revving themselves up too much with their athletic exploits. Maybe they need something gentler, like yoga, or something like Tai Chi.
Yeah, I mean, exercise, as we know, is good for everything. And one of the things that exercise does, when you're in the midst of exercising, yes, your sympathetic nervous system, that part of your nervous system that's going to be responsible for fight or flight, is active.
Right.
Your
But it
heart
has
rate
a
goes up.
hormetic effect. It's like a little bit of what doesn't kill you makes you
Yeah,
stronger. Yeah.
but the result of exercising actually increases your parasympathetic nervous system, which is the part of your nervous system that helps calm us down.
Right.
It improves digestion, it decreases our heart rate, it decreases our blood
Right.
pressure. So, yeah, it may sound counterintuitive to say to someone who's anxious, you should exercise,
Right.
but you should
Yeah.
because it's good for you and it will actually help decrease your anxiety overall.
Right. And as you exercise and you become better conditioned, you'll notice that the time that it takes for your heart rate to go back to normal decreases. And that's actually a sign of autonomic balance. And the
Yeah.
parasympathetic is what acts as kind of a governor on your heart rate, bringing it back down to normal. So you want good parasympathetic tone to balance out the, adrenaline and the activation of the sympathetic nervous system.
Right. And also, I think what you said in terms of other options, like things like yoga, tai chi, those are great for influencing your parasympathetic nervous system. And they are excellent non-pharmacologic things that one can do to help reduce stress and anxiety.
Indeed. Okay, so when it comes to people who have physical ailments like, say, irritable bowel syndrome,
Mhm.
uh, why shouldn't patients take umbrage at the suggestion that they undertake CBT, cognitive behavioral therapy? Is that an admission that it's all in their head, or what?
No, absolutely not. I mean, I think that, most good gastroenterologists, and it's funny because one of the people who reviewed my book is my own GI doc, who I see every 5 years just for a routine scope. But she was kind enough to review it for me. And she talks about this with her patients all the time, that yes, you have irritable bowel, you can take medication, we can relieve some of your symptoms, but you're not fixing the underlying reason that this might be happening. So, when I get referrals from gastroenterologists, which is pretty often, and folks come in, I'm like, I want you to understand that your symptoms are real. But generally, people who have irritable bowel are anxious. And
Hmm.
if we can treat your
Yeah, and it's a
anxiety, your
vicious
symptoms are
cycle.
going to get better.
It engenders anxiety, and anxiety
Yeah.
makes the condition worse. And so, what does that entail? What is CBT? I mean, is it lying on a couch and having exhaustive sessions where you
No.
review your childhood trauma? Maybe you had a cold mother or an authoritarian father, and it's all rooted in that.
No, no. CBT stands for cognitive behavioral therapy, and I have to admit I am not a cognitive behavioral therapist, but I know really good ones, and that's who I refer to.
Okay.
What CBT does is it helps people recognize the distortions in their thinking, and we all have distortions in our thinking. It's really, I don't know where you are right now, but where I am right now, it's 100 degrees outside
Mhm.
and unbearable. So I could say, oh my God, this weather is so horrible. It's never going to get better. I'm going to die if I go outside today. Well, that's an
Plus,
extreme,
plus, there's
right?
a smoky pall hanging over New York, so you really, it's yeah,
Yeah, because that's coming from Canada,
yeah.
because I was just in Canada last week and I know where the wildfires are. But the point being that we all have distortions in our thinking. And if we, people who are anxious often engage in a pattern of thinking called catastrophic thinking.
Hmm.
So what does that mean? It means I have a bump here oh my God, it's got to be cancer. There's nothing else it could possibly be. Oh my God, what's this going to happen? I'm going to die. I really should look at my will. Oh no, what about my children? That's catastrophic
Yep. You
thinking,
go
as opposed
right
to,
down the rabbit hole. Yep.
exactly, you go from 0 to 100,
Yep.
as opposed to, I have a bump here. Ooh, maybe it's a mosquito bite. Oh yeah, I was walking in the woods. Yeah, it's kind of itchy. Maybe
Hmm.
it's that. So a good cognitive behavioral therapist will help the individual consider other options for why they think the way they do. And in so doing, decrease anxiety. It works beautifully for people who have anxiety disorders.
Hmm. So it's kind of a reframing your situation.
Yeah,
Could that be applicable to pain syndromes?
totally. Yes. Everybody has different experiences of pain, and without going into all the details about, gate theory, about, how people let certain signals come in versus others who don't. Um, yes, if the way you interpret pain can actually influence how you feel it. I'll give you an example.
Sure.
Me, right now,
Yeah.
my knee is not looking great because I had an injury several years ago. And at this point, I'm going to need something to make it better other than just getting a cortisone shot. But I know it's there. I don't pay a lot of attention to it. I hiked 10 miles the first day I was in Canada, which is ridiculous. Someone who has a different, because I know it's not going to kill me, and I
Hmm.
know there's a way
Hmm.
that I can get
You
relief.
contextualize it.
Yeah. And someone who has a different experience of pain. And there are people who are quite sensitive to almost anything, like you touch their skin and they feel it more severely than someone else who it's like, okay, you're just touching my skin. But someone who has a different interpretation or different sensation of what their pain is like is going to exaggerate its significance and is going to become much more preoccupied by it. And in so doing, may become more disabled because they'll stop engaging in behaviors that they think is going to make it worse, even though on the surface, then the doctor may be telling them, you can still exercise. You're
Yeah.
not going to make this injury worse.
In fact,
Just
now studies have demonstrated that this whole way that we treat low back pain by putting people in traction and
right
immobilizing them was
is the
totally
worst thing you can do.
counterproductive. Yeah.
Yeah. So that's an example of how, CBT can be used to treat patients with pain, is that you put the pain in context. It's uncomfortable. Yes, there are things you can do about it. Yes, it doesn't mean the end of the world, and it doesn't mean you're going to die because you have this pain.
Indeed. So you got to kind of divorce the actuality from the connotations, most of which are
Hmm.
negative, right?
Yes.
Yep. In the book, you talk about autoimmune disease. What insights do
Mhm.
you have about autoimmune disease?
A lot of them, actually, for different reasons. In psychiatry, we see a lot of autoimmune disorders, and autoimmune disorders are those that occur when our immune system, that's supposed to be protecting us from any kind of injury or invader or bacteria, basically goes into overdrive and doesn't recognize our own tissue as being our own. And so it starts to actually attack our own organs and our own body systems. My own daughter, who is a rheumatologist, actually has several autoimmune disorders, so I'm quite familiar with it.
Maybe that prompted
Uh,
her to go into that field.
I think it did, and she's very good at what she does. But autoimmune disorders are very much influenced by stress, because stress causes inflammation, and autoimmune disorders are the reason people have symptoms in autoimmune disorders is because of inflammation. And depending upon where the inflammation is, that's going to be their target organ. So I think you said you were talking earlier about rheumatoid arthritis.
Hmm.
Rheumatoid arthritis is arthritis that usually affects, the joints. There are other versions of it, like psoriatic arthritis, which also affects the skin. But people will tend to have what they call flares, or like their symptoms will get worse, often after significant stress.
Hmm.
So if you can reduce the stress in different ways, like we talked earlier about what you eat, you can eat an anti-inflammatory diet, you can engage in certain kind of exercise, which will reduce the inflammation. But one of the things we haven't really talked about, and maybe you have it on the scorecard for later,
Sure.
is the importance of sleep.
Oh, absolutely. Yeah, let's talk about that.
So I think that people underestimate the importance of sleep. particularly in my neck of the woods here outside of Washington, D.C. People wear it almost as a badge of honor that, oh, I only need to sleep 4 or 5 hours. Well, that's ridiculous because what happens during sleep is your brain basically gets a reset. So people may have heard about the lymphatic system. It drains
Hmm.
excess lymph from the body.
Yep.
Scientists discovered about 10 years ago a system in the brain called the lymphatic nervous
Just add a
system.
G to lymphatic.
Correct. And essentially, think of it as a power washing system. So it power washes your brain from all the bad stuff that's accumulated during the day. Free radicals, whatever kind of gunk has gotten in there. The key is it only works when you're asleep.
Hmm.
If you don't sleep, you're not getting the benefit. So we know that poor sleep is very much related to lots of chronic illness, including heart disease. We're now seeing it more in terms of neurodegenerative disorders, things like Alzheimer's and
Yes.
Parkinson's.
Yeah.
So I have a lot of patients in my practice who have sleep apnea, and
Hmm.
I am harping on them all the time. You got to wear your CPAP. You got
Fix
to wear,
fix your
you
sleep,
got to,
and your condition will get
because if you
better.
don't,
Yeah.
yeah, because if you don't, you're going to shorten your life.
Yeah.
So also, if you don't sleep well, it increases inflammation. So another good reason to sleep efficiently. Now, I say efficiently, you can be unconscious for 10 hours, but if you're not sleeping efficiently, meaning you don't get into deep restorative sleep, it's not going to do you any good. But if you have a good sleep routine and you sleep on a regular basis and you sleep enough, it's going to do your entire body a lot of good, and your mood.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Please listen up. What if one supplement could make your entire immune system smarter, not stronger, in an aggressive way, smarter? That's exactly what BWH 85 beta glucan from BWH Labs does. It works with your immune system, helping it recognize threats, respond effectively, and protect you the way nature intended. BWH Labs has spent over 25 years perfecting the purest, most biologically active beta-glucan on the market, an 85% pure formula that's been tested against 200 competitors and named the most effective immune modulator in peer-reviewed research. The science speaks for itself, just one ingredient, one focus. Unmatched results. Doctors and integrative health practitioners trust BWH 85 beta-glucan, and so do I. It's available in 100 milligrams for daily support or 500 milligrams for maximum immune defense. It's only available through health practitioners, but as an intelligent medicine listener, it's available to you through my full script dispensary. Just go to drhoffman.com/BWH for more information and to order. That's drhoffman.com/BWH, because a smarter immune system starts with one smart choice. You know that feeling. You're exhausted, but your brain just won't quit. You're staring at the ceiling, watching the clock, dreading the morning. Here's something that actually helps. It's called Kyolic Specialty Series Sleep Mushrooms Plus. And it's unlike anything you've tried before. This isn't some chemical sleep aid that leaves you foggy and dragging the next day. This is a clean botanical formula built around certified organic reishi mushrooms grown on real farms, not in a lab, combined with valerian root to help you fall asleep faster and stay asleep longer, L-theanine to quiet that racing mind, and Kyolic aged garlic extract, one of the most trusted wellness ingredients available for circulation and stress support. It's vegan, non-GMO, no gluten, no dairy, no artificial anything. Just 2 capsules, 2 hours before bed, and you wake up actually rested, not groggy, not out of it, just refreshed. Kyolic Sleep Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening, and thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Susan Trackman, author of It's Not Just in Your Head. In your book, you reflect on the COVID pandemic and the impact that it's had on people. What have you seen in your practice?
Seen a lot of things. I was practicing during COVID, and it's the first time in my entire career that I ever started seeing people virtually like we're doing now.
Mm-hmm.
I had never seen anyone virtual before that, but it got to the point where, it was not going to be safe for me to see people in my
Sure.
office. And
But people were
I
in
couldn't.
distress and they needed help.
Yes. So we came up with a strategy and a HIPAA compliant portal to see people virtually. So what I saw were a lot of different things. One, there was certainly an increase in depression. People who like to be around others and now are confined to their home were missing kind of social interactions or seeing loved ones, grandparents who couldn't see their grandkids because it wasn't safe. A lot of increased depression, a lot of increase in anxiety. For people who had attention deficit disorder, which I treat also, I have a significant population who have attention deficit disorder. They got worse because being on the screen all day
Hmm.
made their symptoms absolutely worse. So that's what I would see in my practice during the pandemic. Since the pandemic, I have a number of cases of people who were diagnosed with what's called long COVID,
Mm-hmm.
or people who presented with symptoms again that were just weird and nobody could figure out what they were. And shortly after that, when I started seeing more and more patients like that, I would say, have you had COVID? And they'd say, yeah. I said, well, when did you have it? And they tell me, like, when did your
Mm-hmm.
symptoms start? And oftentimes it was subsequent to having the COVID infection. The good news is that I think all of them have resolved at this point.
Mm-hmm.
But even myself, I had COVID twice. I never tested positive, but I know I had it because I had the
Mm-hmm.
most bizarre symptoms I've ever had in my life. But, good for me, they went away. But, this is a tricky virus. We still really don't know enough about it in that this was a virus that caused lots of inflammation and it caused lots of inflammation in lots of different places. So it was almost like shotgun. Like if
Yeah.
if shotgun was going at, it could hit your brain, it could hit your
Yeah.
heart, it could hit your joints, it could hit your liver, it could hit your kidneys. And one of my daughter's friends who had had COVID, never had a history of any kind of seizures, developed intractable seizures
Hmm.
to the point where nothing was going to
Clearly a brain
keep her
disorder. Yeah.
stable.
Yeah.
And I said, Emma, my daughter's name, I said, Emma, when did she have COVID? And she told me, and I said, I bet you anything's COVID related. But she went to Mayo during this time. And again, we didn't know that much then. So they
Yeah.
couldn't come up with a reason. But again, knock on wood, it resolved. She's fine. So this was a nasty virus, but any virus can cause inflammation. And people often wonder, like, why did I get depressed when I had the flu?
Yeah. What's going on there?
Because well, good question. I mean, the flu obviously is an inflammatory process and it affects multiple organs, but it also affects your brain.
Mm-hmm.
So it impacts the balance of neurotransmitters. And it's not uncommon for people to get depressed
Mm-hmm.
transiently,
No.
either during or after they have a bout of the flu or other kind of viral infection or bacterial infection.
Yeah. You just anecdotally, many years ago, it was back in 2006, I was on my bike and I crashed and I
Mm.
had a femoral fracture, almost a
Ooh,
hip fracture. Fortunately, I didn't need a hip replacement. It was a devastating fracture. And I was,
yeah,
had to lie abed and, then I, got on the crutches and, it was a very, very debilitating thing. And I have to say that
yeah,
there was interesting mood effects of that
yeah.
is I love to shop. And in lieu of sometimes physically shopping, I love to just window shop, just look at stuff. I
Ah, okay.
absolutely lost interest in that
Mm,
for
wow.
several months. And then once I started feeling better, I said, hey, let me
Let's
just
go
go to a
shopping.
let's go shopping.
Let's go
I
shopping.
think it really created what's called
Yeah,
anhedonia. I think
yeah,
made famous
yeah,
by Woody Allen's film Annie Hall, because
yeah,
I think that was
yeah.
there was a take on the word anhedonia because he's
Right.
the perennial psychiatric patient.
Yes.
So yeah,
Yeah.
so there's something to it. Is that illness depletes your dopamine or something like that?
Well, it causes a shift in neurochemistry.
Yeah,
And I have patients in my practice who I call the elite athletes or and I think you can only do something to the extreme so long before something's going to break or get hurt.
yeah,
And a
right.
lot of my patients use exercise as a way to self-medicate against
Yeah,
anxiety or depression.
and
Good for you.
I confess, I fess up. I think it's a
But
wonderful natural antidepressant.
it is. However, just like you, when they get hurt, they end up in my office being depressed
Yes,
because they
indeed.
can't use their usual
Yeah,
strategies to
yeah.
make themselves not feel depressed because
They
they're
have
in.
they have withdrawal symptoms.
Yeah, totally.
Interesting. Uh, so I don't know if it's in your book, but something that's really happening these days is a lot of people are on these GLP-1 weight loss
Yeah,
medications. Have you
yeah.
noticed anything going on psychiatrically or psychologically with these individuals? Because you have a real bird's eye view on what's
Yeah.
happening.
Yeah, I'm glad you asked, and no, it's not included in my book.
A
But
relatively new phenomenon, and yeah.
you know what I like to say is anything that sounds too good to be true is probably too good to be true.
Hmm.
And I think that's correct in this case, meaning these GLP-1s can be life-saving. I mean, if you are someone who's morbidly obese and you are at risk for, heart disease and hypertension and diabetes, they are lifesavers. Unfortunately, and I wrote an article about this for my blog not too long ago. Providers are not screening effectively about who they are prescribing them for,
Hmm.
meaning if you have a history of an eating disorder,
Which is what's the prevalence in the population? I think it's significant single digits.
yeah, it might even be up to
Up to
10%. I mean, who knows?
12
But
15, who knows, but
right,
even
but
without short of you know uh complete anorexia nervosa, people have some funky attitudes about food
right. Yes.
and
And
weight.
the other thing that's concerning is that the effect of these GLP-1s is that it dampens your, not just your food noise, you're thinking about the food all the time.
Hmm.
It actually dampens your response to a hunger cue.
Hmm.
So, what is the situation in someone who has anorexia? They lose the ability to respond to a hunger cue.
Hmm.
So, it definitely puts some people, not all, some people who have had eating disorders going on a GLP-1 can put you at risk. The other thing I think that's very, very dangerous is that these medications are being provided by lots of types of providers, not necessarily MDs who have the same kind of training that you and I do.
Hmm.
There are these pop-up clinics, there are these online
Yeah,
facilities that will prescribe
you'll be
GLP-1s
interviewed by
without
a health
screening.
professional who may be an RN.
Whoever that might
Yeah,
be, right?
yeah,
It can
right.
be, like the secretary next door. I mean, who knows, right?
Yeah,
You just don't know. And, you do a quote screening, but you know what? If you are a teenager who wants to lose 20 pounds so that they look good at
for
the
the
prom,
prom, yeah, or something like that.
they're going to lie
Yeah.
to the point where these are money-making organizations, and you're going to get your GLP-1, and maybe you'll lose your 10 pounds, but maybe you're going to start losing more than you should.
Hmm.
Um, and not to name names, but if you've ever watched, and I don't watch reality show, but I was on vacation with my daughter who likes to. If you've ever watched The Real Housewives of anything,
Uh-huh.
they've all got the Ozempic face.
Yeah.
What's the Ozempic face? They look incredibly drawn.
Gaunt. Yeah.
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 Yeah. So they're being misused.
Yeah.
And, last thing I'll say about this, because you may want to get off or on a different topic.
Yeah.
The other thing that I've seen now with patients, even who don't have eating disorders, is what I call the meh phenomenon.
Yeah,
And
yeah, that's what I wanted
like
to ask about.
meh.
If it dampens your
Yeah.
appetite, does it dampen other drives? Does it make you feel
Yeah.
kind of flat a little bit?
I'm starting to hear more and more patients saying to me, I don't feel depressed, but I just don't have interest in anything. And my first question is, are you on a GLP-1? Yeah. Yeah. It's not 100%, but
Hmm.
I'm seeing more and more of
It's a
it.
risk
And
factor. Yeah.
yeah, I don't think it's reported
Yeah.
enough. The way to reverse it is not to give you more of an antidepressant. It's to reduce your dose of the GLP-1.
Hmm. And finally, and there's a lot of these topics are covered in depth in your book. It's not just in your head, but I wanted to ask you, in light of a recent study, and I know this is controversial, but a study came out recently. I think it was out of the University of Adelaide in
Mhm.
Australia. And there's a guy, I've interviewed him. His name is Dr. Horowitz. He's a kind of a foe of long-term SSRI prescribing. And he's
Mhm.
also, just like Dr. Glenn Mullen at Harvard, who wrote the book Prozac Backlash. He points out that there's a lot of withdrawal symptoms when people try to get off
Mhm.
SSRIs. And
Mhm.
what this study says is that a lot of the studies that show that it's probably not a good idea to take people off SSRIs that long-term SSRI prescribing is desirable for most people, it's okay, are tainted by the fact that when people go off SSRIs, it seems that they get depressed again, but they also get a lot of withdrawal symptoms, and makes them think that they need to be on SSRIs. And the recommendation actually is that maybe SSRIs should be used for short-term interventions until people get past a rough patch.
Well, what I would say to that is most prescriptions for antidepressants in this country are not written by psychiatrists. They're written by primary care doctors and now nurse practitioners. And I think that, as with any specialty, one has to be very conscientious about what are you hoping to succeed by putting somebody on medication, and how often do you see them in follow-up, and assess, do they need to continue to be on this medication? For some patients of mine, it is life-saving. There's no way they're coming
And there's
off
no question about that. I will acknowledge
because they
that.
will be suicidal.
Yeah.
I mean, I've got patients who are pregnant right now who are staying on their SSRIs because they have to, because otherwise they're going to be at extreme risk for postpartum depression. The problem is when someone wants to come off an SSRI, and I've done this, I don't even tell you how many times I've done this. You've got to taper them correctly so that they don't get withdrawal symptoms. But if you're not being seen by a psychiatrist, or you're not being seen by someone who knows what they're doing and following up with you regularly, that's when those things happen. So in my practice, and again, I've been in practice for over 30 years, I've never, knock on wood, had a bad outcome. But I'm very careful about what I do, and I know the way to do it, and I know what to look out for, and my patients know what to look out for. There's someone I saw just this morning who wanted to reduce their generic version of Cymbalta. So that's fine. We're going to do it by this amount. This is what you should look out for. If you experience this, I want you to contact me because we can fix it. So there's no reason that people should go through withdrawal if they're being treated appropriately.
But there is a prospect for patients who are put on antidepressants that at some future time, maybe they've matured, they've gotten past a rough situation in their life. Maybe they've adopted better lifestyle practices, such as you advocate in this book, better sleep, exercise, better diet, that it can then, get rid of the trainer wheels gradually and then, go on to function normally.
Yeah, I'm never opposed. I shouldn't say never. I'm usually not opposed to having someone come off their antidepressant. If the situation looks like they're stable in their life, there's nothing that I think potentially is going to influence them. They don't have a history of suicide. They're not going to risk relapsing from some kind of substance. And the only thing I recommend is, if we're going to do this, let's do this at a time when it's quiet in your life, not when you're getting married, not when you're getting divorced, not when
give
you're
it the
moving,
best chance.
Starting school. Yeah. But no, totally. I don't think everybody should be on antidepressants long term. No.
Good stuff. All right. Well, lots more can be found in the book. It's Not Just in Your Head: Demystifying the Brain-Body Connection in Medical Illness. Our guest, Dr. Susan Trackman. You can also read her contributions in Psychology Today, which are excellent. And anything to add?
No, but thank you so much for this opportunity. I really enjoyed it.
Well, yeah, great conversation. Thank you. And thanks for being, someone who thinks a little bit out of the box about psychiatric problems. Looking not just at, which medication is the appropriate one, but looking at root causes and doing kind of an all of the above approach with your patients. So great stuff. And by the way, you have a practice, and your practice but you seem to be Washington-based, DC-based. You said New York City?
I'm in Northern Virginia.
You're in Northern Virginia. Okay. Okay. And by the way, is there an opportunity for telemedicine with you still? Can people consult with you, or do they have to see you in person?
They can consult with me, but the issue is, of course, they've got to be within the area where I have a license. So I couldn't see somebody, for example, out of what we call NOVA, Maryland, Virginia, DC. I couldn't see somebody, for example, you're in New York, right?
Yeah. Mm-hmm.
So I could not see somebody virtually in New York.
Okay. Yeah. You can, but each state has to have the whatever part of the compact that's required for allowing telemedicine. So, you can find her, and if you want to get a second opinion, you can, perhaps if you're in the right state, you can obtain a consultation with Dr. Trackman. Thank you very much for joining us.
Well, thanks again for having me. I really appreciate it.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA-compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.